One of my harder stories when I worked as a hospitalist was I had a family who one of the parents was deployed and they had twins. And both of the twins, who were about 4 months old, contracted RSV bronchiolitis. One was admitted to the ICU and one was admitted to the floor. The other parent was alone, there was no other support systems, and they had to try to make a decision between going to one child in the ICU and going to the other child in the hospital. As a resident, we would take turns and go hold the baby, whichever place the parent couldn't be. We had little to offer: oxygen, sometimes breathing treatments, IVs for hydration, and just monitoring and make sure that if things got worse, we could intubate, and one baby was intubated. Thank goodness both of these children did recover and did quite well. But watching that happen was one of the more traumatic things that I went through as a training doctor. I can't imagine what it felt like for a parent. These stories happened every single minute during RSV season in our country. We finally have something we can do. If you are pregnant, talk to your provider about the RSV vaccination that you can get to protect your baby. If your baby is already born and under the age of 8 months, talk to your provider about the RSV monoclonal antibody, which can slow down the infection so they get less complications, and up to 16 months if they have medical problems. We have something we can do finally to prevent things like that from happening, and I could not be more excited. So let's do this together and try to keep our youngest safe from RSV. Take care.